Video content or information here is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Please also see the written disclaimer with more details below. Thank you. Hi, I'd like to talk to you about the grading of breast cancers. So the stage is on a scale from 0 to 4, 0, 1, 2, 3, 4. But grade is on a scale of 1 to 3. What it means in grade, a grade will contribute to whatever stage you have. But the grade means when I look at the cells, or the pathologist looks at the cells underneath the microscope, how similar does that tissue look to normal cells? So a grade 1 will look very similar to a normal breast cell. A normal breast cell just looks like a cube, and it's like little cube cells or columnar cells that line the inside of the tube or duct. So it's like having a smooth lining that's all one cube or one cell layer all around, like inside of your sink, of your drain. Now, that's a normal cell. Then in the grade 1 will look like a normal cube cell. It also will have usually a high estrogen and progesterone receptor. So normal breast cells have no HER2 receptors, HER-2-NEU, HER2-NEU. Normal breast cells do not carry HER2 receptors. Receptors are little things that go outside of a cell that then bind like a lock and key to help promote the action. So an estrogen molecule will bind to an estrogen receptor and help the breast proliferate during puberty, or help the breast lactate during pregnancy, or after pregnancy. Progesterone, similarly, the progesterone molecule will bind to a progesterone receptor and cause activity within the cell. Normal breast cells carry 100% estrogen and progesterone receptors and no HER2-NEU receptors. But cancer could produce HER2-NEU cells, and we know that those patients will have an excellent outcome but will require chemotherapy. The estrogen and progesterone receptor are used as indicators of what type of tumor you have, but we only use the estrogen receptor to help with treatment. If you have an estrogen positive tumor, you will likely benefit from taking an anti-estrogen pill after surgery, radiation, or chemotherapy if you need them. So grade 1 cells will often produce a lot of estrogen and progesterone cells. Grade 3 cells look very abnormal. So think about that tube underneath your sink, the tube in your breast. It's all gunky, it's all sort of white, it's all together, and it's very abnormal looking. The columnar or cuboidal cells look very abnormally shaped. And then grade 2 is in the middle. They don't look totally normal or close to normal. They don't look really abnormal. They're somewhere in the middle. So grade contributes to stage, but it's not the same thing. Grade just means how similar does your tumor look to normal cells. Grade 1, a lot like. Grade 3, not very like. 2, somewhere in the middle. So that is the grading of breast cancer.